We are back on the town hall now with an in-depth look at hospitalizations as the pandemic continues. The trend is not great here in Western New York, and we'll show you that in just a moment. But we are nowhere near the crisis point that we are seeing in some other states.
And context is important here. So we did some digging today to show you what it is like in Western New York hospitals right now. The bad news is hospitalizations are going up. So this is the Western New York region defined by the state as Erie, Niagara, Chautauqua, Cattaraugus, and Allegheny counties. We now have more than 100 COVID patients in hospitals in those counties. For perspective, last year at this time, we only had 24. So we're 330% higher now. And just a reminder, there was no vaccine at this time last summer.
The good news is that we have a lot of capacity here locally, especially in our intensive care units. So we spent today looking through data from the U.S. Department of Health and Human Services for every hospital in all 8 of our counties. And for the week ending August 12th, 268 of the 421 ICU beds were occupied. That includes COVID and non-COVID patients. So that leaves about 36% of our ICU beds that are open. That is not the case in some southern states like Alabama, where intensive care units are overwhelmed. Watch this.
The Alabama Hospital Association reports that there are only 2 ICU beds available across the entire state.
The high volume of both COVID and non-COVID patients being treated right now has created what Chief Operating Officer Ginger Henry calls
the most difficult thing I think that we've faced yet.
Henry says every ICU bed across the Baptist Health System is full.
We have patients who require ICU level care that I can't get into an ICU bed every day.
So certainly some perspective there that it's a situation that is better here, but you certainly don't want it to be getting to that level where it's worse.
Yeah, I mean, think about that. 2 ICU beds in an entire state. And there are several states throughout the South right now that are in that kind of dire shape.
That's reality for them.
Yeah. All right, now let's talk about the Delta variant that really has been driving the spike in those cases and hospitalizations. It's clear that there is a lot of misinformation out there when it comes to how the virus mutates and why Delta is so concerning.
So tonight we hope to clear up some of that confusion. We no longer have to call this variant B117 or this one B16172. We can just call this Alpha and this one Delta. Let's focus on the variants of concern: Alpha, Beta, Gamma, and Delta. Yes, that is the start of the Greek alphabet. Alpha first showed up in the United Kingdom, Beta in South Africa, Gamma in Brazil, and Delta in India. Delta might not be a much deadlier version of SARS-CoV-2, but it's a heck of a lot more contagious. How much more? Well, consider what's known as the R0, or average number of people a sick person typically infects. The seasonal flu, according to the CDC, has an R0 of around 1, meaning every person who gets it tends to infect one more. The original SARS-CoV-2, the virus that causes COVID-19, last year had an R0 of 1.5 to 3. Infectious? Yes, as infectious as the swine flu. But as SARS-CoV-2 evolved and new variants arose, changes happened, bringing us the Delta variant. Smallpox, a very contagious disease, has an R0 close to 5. Delta, anywhere from 5 to 9, according to the CDC. That's almost in chickenpox territory. And remember, COVID is more deadly than that. And then there's measles, one of the most contagious things on Earth. It has an R0 of around 12. The good thing is, we rarely have measles outbreaks these days. Why? Rhymes with smackzine. Anywho, maybe this is, as we say, all Greek to you, but as you consider what this all means to you, consider how contagious Delta really is. Honestly, it's nothing to sneeze at.
Yeah, it does help put into perspective why this matters so much.
Because you really understand, you might not understand Delta variant, but you certainly understand chickenpox, smallpox. Those are all things that we can understand and put some
relatability to.
Yeah, when you can compare it to something else that we know is so infectious, it's like, okay, this is legit.
I get it, yeah.
All right, coming up for us here on this Tuesday, we're talking about vaccine mandates, including questions about those religious exemptions and whether or not service members can be discharged if they refuse to get the shot.
Plus, we're going to talk about the forecast when we come back. That's a pretty picture tonight. We'll be right back.